East Africa is in the midst of its worst drought in decades. An estimated 13 million people are facing a severe food crisis and in urgent need of emergency assistance. Turkana, an isolated and sparsely populated region of northwest Kenya, has been hit particularly hard by the drought.
It's a bit of a forgotten area, I think, Turkana. It deserves much more attention, including political attention.
We started getting reports at the beginning of the year from the meteorological department that the rains would fail.
It's been over 5 years since Turkana has received enough rain to support its population.
Currently, this region is facing what people are saying is the worst drought in 60 years.
The drying up of many of the region's wells and boreholes has forced many people to travel great distances in search of new water sources.
A lot of the people who were coming in with malnutrition, so those were like the initial indications that yes, there's a problem as far as food security was concerned.
The drought has also led to the death of livestock, a main source of food and income for the people of Turkana.
Malnutrition rate of as high as 30%, that's like double the humanitarian emergency threshold. So that, at that point we started seeing that things were not really good.
With active wells growing more and more scarce, many children, some as young as 5, have had to quit school to help their families find water in order to survive.
In this school, we have 368 boys and girls. The problem that actually the school is facing is a permanent problem, that is water crisis. That's affecting the school very much.
School enrollment has been going low because of the same. Sometimes when these parents move, they go with their children to help them. And also because the school has been having no water, people have been running from this school to the schools nearby. And this has really affected the performance of the school and also the enrollment.
In collaboration with SIDA, the International Rescue Committee has ramped up its efforts in Turkana in response to the crisis. IRC staff are providing health services, food distribution and training in hygiene at schools across the region. These programs are helping to reduce malnutrition and other diseases caused by the drought. The IRC's water delivery is bringing thousands of liters of water to schools and health centers in affected areas.
The International Rescue Committee has been working in Kenya since 1992. We've been working throughout Greater Turkana since 2002. And our programs are focused on emergency response, like we're doing right now, but also on long-term resilience.
The Swedish government is putting in quite a lot of humanitarian aid and support in this region. We looked at IRC as being a trusted partner.
With IRC and SIDA bringing this help, it will improve the school and even the community.
Kwa sisi tumeshukuru vile wanaleta maji, tumepata hata njia ya kusoma. Sasa ni last time nilikuwa natafutanga maji mbali. Sasa tumeshukuru tumepata hata nafasi ya kusoma. Hatutakuwa na shida tena ya kutafuta maji mahali.
All told, some 7,440 people in Turkana, including 5,000 children, are being provided with clean water. More than 10,000 people are benefiting from nutrition programs, and IRC health services have provided medical care to thousands more.
There will be droughts in the future, so that's why we do need to make sure that any response that we have is focused on short-term results, but also keeps an eye towards longer-term resilience of the communities, the Turkana community that we're working with specifically.
The crisis is far from over, but by working with local communities to provide water and health services, the IRC has helped many people in Turkana survive this ongoing drought and start down the path to a full recovery.
We have recently enhanced the support to IRC and we're very pleased with that, and we look forward to continued cooperation.
IRC and SIDA have only come for the first time maybe, and have really left a mark. And I also hope they will continue leaving more marks than the one they have left.